Someone who, I'm 56 years old. I've been through a few events in my life, maybe watching the man land on the moon and 9/11, and you remember where you were on certain events. And this is a time in our country's history where we need to do extraordinary things. And some of the folks in my generation don't know about those things. And so here's really a request from your leaders that there are things we can do as a community to make us healthier and prevent this pandemic from spreading. And it's extremely important that we take measures now. And so it's our time in our community to do great things. We will come out of this, but right now it's time for us to take extraordinary measures.
It's a very unusual situation. We haven't been here in public health terms for probably over 100 years. And so it's something we all need to respond to. Personally, my approach is to remain calm and remain focused. And I hope that as many of our neighbors and friends can do that as possible, because that's what we need to do.
I finding that this community is really resourceful and creative, and I encourage people to continue to find those ways to reach out to your neighbor. Maybe that does not mean that you're going over and sitting down and having coffee, but maybe it's a phone call, or maybe it's just a text message or a funny Facebook post that you put out there to encourage your neighbor and help folks along. This is difficult. People, the emotional roller coaster ride that folks are feeling is real, and the part that we can play to support each other that way is great. I love that creative thinking.
So at Confluence Health, we unfortunately had the one individual a couple of weeks ago who was hospitalized and has passed away with this disease. And in our screening over the last few days, we have had 2 patients come positive with that, 61 others over the course of the last 2 weeks that we've been intermittently testing are negative, and there are 308 pending samples out there. The other message I want to give off the bat is COVID-19 is not the only health condition in this city or in this region. All of the usual things like heart attacks and strokes and infections from other organisms are continuing. There are still people with diabetes, there are still people with high blood pressure, there are still people with asthma, and we need to continue all of those healthcare efforts, because we will come out of this and we will still be a community, and we're going to need to have healthy people in this community to carry us forward.
This is a special time. And now our biggest partner for keeping people healthy and well is the community itself. It's often said that health is determined more by what individuals do than by what happens in a doctor's office. What individuals need to do now is exactly what Peter and Barry were talking about. Staying out of large groups, staying at home, call it social distancing, call it whatever you want. That will do more to make sure we get through this as well as we do than anything else.